Hello everyone, and welcome to this audio podcast. This audio podcast synopsis. This synopsis as part of the Labostix International. This audio podcast synopsis as part of a Sonar and Critical. This audio podcast as part of an Interstellar and Rampage, and this audio podcast synopsis as part of a Storm Labostix production. As part of this synopsis, a look at in around a sort of anticipated or projected works that looks to be anticipated sort of led by colleagues in as part of the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS group for kids and the projected works looks in around a national an overview in around a national study to understand how understand coping in children and young people with chronic kidney disease and other conditions. The As part of this synopsis, a little bit in around a little bit around sort of the sort of abstract aspects of this projected works. Again, the RPSG, the Renal Patient Support Group, the RPSG are the lead in as part of this works. So CKD, chronic kidney disease, is an irreversible sort of condition and profoundly affecting children and young people, and across physiological and pathophysiological aspects of the condition, additionally in around sort of aspects pertaining to lifestyle that can be affected in as part of the condition. Young people, children and young people with CKD in the age populations between 10 years of age and up to 25 years of age can face a sort of lifetime of challenges associated with CKD, with CKD or chronic kidney disease, and with other conditions. Research has informed that children and young people with CKD at the severe end of CKD utilize a number of coping strategies. Additionally, works has been published to inform of some of the most pertinent or important topics that renal patients or kidney patients find are important as part of their sort of trajectory. At the same time, data now is required to understand. Data now is required to understand how children and young people sort of cope over time, and especially in those with CKD, chronic kidney disease, in addition to CKD, chronic kidney disease, and other conditions. For example, conditions such as Down syndrome, cerebral palsy, and multiple sclerosis, and where they can have healthcare challenges throughout the condition, throughout trajectories. The aim as part of this work is projected work will look to understand coping in children and young people and children and young people with CKD and other CKD with other conditions, involving participants across two social media platforms, the RPSG and KDARS, and up to and several children or young people, sort of kidney specialist services, services. The objectives are to initially to look to inform of what coping strategies participants adapt. Secondly, to highlight challenges that children and young people have with CKD and CKD with other healthcare conditions, and additionally to see how kidney care services for children and young people can be made better, and then additionally to develop, to see a sort of a co-developing of a national coping guideline that is linked between organisations such as the British Association of Paediatric Nephrology (BAPN) and the Royal College of Paediatrics and Child Health. As part of the sort of main outcome is to understand how children and young people cope with different forms of disease or conditions, and how it should be and how the understanding should be integrated into as part of kidney care services, and at the same time, one of the main outcomes for the project is to of the projected works is to envisage a co-developed a co-developed a sort of national coping guideline to complement clinical practices for children and young people suffering with chronic kidney disease and chronic kidney disease with other conditions. To identify similar works or in amongst the literature, similar works or in around themes in amongst the literature, using search engines such as PubMed or Medline, for example. Terminology such as kidney care or nephrology, social media, coping, and mixed methodology can be utilized to identify or look to identify sort of similar literature in amongst the evidence base. So that draws this audio podcast and synopsis to a close. This audio podcast synopsis, again, as part of the Labostix International. This audio podcast synopsis is part of a Sonar and Critical. This audio podcast is part of an Interstellar and Rampage. And this audio podcast synopsis as part of a Storm Labostix production.